Good evening, everyone. My name is Amechi Lilian Ugodaya. Welcome, Dr. Knight and my fellow classmates to my presentation on DMPU 705 Health Communication Project, and my topic of interest is type 2 diabetes, a rising threat in our community. This here is my topic, and this is infograph on educational piece on type 2 diabetes. This talks about risk factors and how it can be prevented. This slide also is interrelated to the previous slide because it both talks about risk factors and modifiable risk factors. If these factors that are modifiable are modified, type 2 diabetes can be prevented. This slide talks about the increase in type 2 diabetes and the consequences it may have if not managed or if goes untreated. These are some of the causes of type 2 diabetes, which includes infection, the kind of food we eat, the kind of lifestyle that we live, abnormal functioning of the liver as well as the pancreas, and our weight. My purpose of the presentation is to create awareness about type 2 diabetes and its prevention. Living a healthy lifestyle is a great way to manage type 2 diabetes and prevent the onset in the future. Spreading awareness about type 2 diabetes can help save a life. Preventing type 2 diabetes is possible and is in our hands. This can be achieved through healthy choices like eating more fruit and vegetables, staying active, following up with our primary care doctors, checking our blood sugar and reporting abnormal figures and numbers to our doctor, and also following up with our lab results and lab works. Education on T2DM, possible symptoms and ways to reduce their individual risk. Importance of spreading awareness about type 2 diabetes can help people with this disorder understand best practices for daily management and dispel myths as well as false beliefs. What I want to accomplish with this presentation is to focus on reducing T2DM cases, its complication and death, because poorly controlled and or untreated diabetes can lead to leg or foot amputation, vision loss, kidney damage, and other major organ loss or damages. I also want to show and demonstrate strategies to help people who don't have diabetes prevent new cases. This talks about risk factors of diabetes and how the government can help us maintain a healthy environment. This slide, I want to support my original information that type 2 diabetes is the most common form of diabetes, and that glucose does not move into the cell, they pile up in the blood, and signs and symptoms when they do occur are often ignored because they may not seem serious, and that type 2 diabetes can develop at any age, but most often times it can be prevented. And this other graphics talks about the type 2 diabetes and the fast sheet. So my closing argument is that type 2 diabetes is an impairment in the way the body regulates and uses sugar. Living with type 2 diabetes means you are at increased risk of complications. Therefore, good self-care is the key to managing the condition effectively and reduce the risk of complications. Proper management of T2DM will help to prevent the increase it poses in our community. This is my references. I want to thank you for your time. I want to thank you for watching. Thank you.